Now, there are certain types of tenosynovitis which we see on day-to-day basis. Okay, so let us start by one. So on T1 weighted sequence, you definitely have to see the anatomical details. You can also detect your tophi and hemorrhage. For fluid sensitive sequence, you go for T2 weighted and stirred sequences. For synovial enhancement, we go for post contrast T1 weighted sequence. And the GRE sequences are reserved for detecting your hemocentrin, which is important for your either a diffuse form of pigmented villanodular synovitis or a localized form. The localized form, we call it as a giant cell tumor of the tenosynovial sheath. So it's actually a misnomer. It's actually not a tumor. I've told you many times. So it's actually nothing but a localized form of PVNS only. Okay. So if you talk about PVNS findings, the same findings will apply to the GCT of the tenosynovial sheath as well. Okay, because it's a variant of PVNS only. So let's start with the simple or serious tenosynovitis, which we see on day-to-day basis. Okay. So you will have all the fluid signals. Okay. On post-contrast images, you will have mild to moderate peripheral enhancement. Okay. But there will be no synovial proliferation. Okay, so in cases of simple serious tenosynovitis, there will be no synovial proliferation. Okay, you have to remember that. Now, if we move on to the infectious tenosynovitis, okay, one thing extra which will be added, one will be your internal debris that will appear as hypointense areas. I'm not talking about rice bodies here because that are again very small. I'm talking about internal debris here. Okay, the enhancement will be marked. Okay, we can have abscess formation also. Okay, we can have synovial thickening also, and the type of fluid, what we call it as complex heterogeneous fluid. Okay. In simple serious tenosynovitis, it was simple homogeneous type of fluid. Okay. So in infectious tenosynovitis, it will not be a good looking fluid and not be a homogeneous fluid. It will be somewhat heterogeneous with some few hypointense areas with like, few septations. Okay. Excessive soft tissue edemas will be there. You can have even abscesses inside the tenosynovial sheet. I'll show you one case. Okay. And you can have synovial thickening also. And the difference between your infectious and somebody asks you from inflammatory tenosynovitis, the amount of fluid will not be as much. Okay, in the inflammatory tenosynovitis, the amount of fluid will be less in comparison to your infectious tenosynovitis. Okay, more amount of synovial thickening will be there in cases of inflammatory tenosynovitis in comparison to the infectious. Okay, so if somebody asks you to compare the infectious and inflammatory, herein the fluid will be more than synovial thickening, and here the synovial thickening will be much more than fluid. Okay, and you can also somewhat see rice bodies here, and here you will be seeing your internal debris. Abscess formation can be seen here in advanced cases. You will not be seeing any abscess formation in cases of inflammatory tenosynovitis. Okay. Now let us look at this case. So if you look at it carefully, you can see that this is a tenosynovitis of the flexor tendon. But what peculiar thing is that here it's not a clean fluid. You can see certain hypointense areas within it, small. Okay, so it's kind of a heterogeneous fluid here. Okay, so this is not a simple tenosynovitis. So this is a case of pyogenic flexor tenosynovitis. So you can see adjacent soft tissue edema as well. Okay. Uh, Intratendinous signal may be abnormal, may not be abnormal. Okay, that is a separate point. But extensive soft tissue edema and a complex heterogeneous fluid, they point towards your infective tenosynovitis. Another case. In this case, there is a tenosynovitis. Along with that, there is abscess formation inside the tenosynovial sheath. Okay, so this is definitely a case of pyogenic tenosynovitis. Okay, so you can have intra-tenosynovial sheath abscess formation.